Hello, everyone, and welcome to Medtalks with Dr. Syed Raza. I'm your host, Dr. Ghazal Saxena. Now, Dr. Syed Raza is a senior cardiologist, physician, author, public speaker, and founder of the Raza Foundation with years of experience in preventive and cardiovascular medicine. So, welcome, Dr. Raza, and it's really great to have you here.
Thank you very much, Dr. Ghazal, for this very kind introduction, and I'm glad to be here.
So, as we've very commonly heard, that water is the very best medicine that we have. So, on this topic, we will expand a bit. So, can you please tell us how is water important for healthy living?
Water is a medicine, and I tell this to a lot of patients because it is a medicine that helps individuals and patients without giving them a single tablet or pill or injection. Just give them water, and a lot of times I see that the problem is resolved.
Right.
And as you know, water is important for our body. 60% of our body is made up of water. Water is cheap, but again, we should not forget that it is a very special and important commodity of our daily living.
Definitely.
And definitely, water hydrates us, and water also regulates our body temperature. It helps to carry oxygen and nutrition to the cells and tissue. It lubricates our joints.
Right.
And also it helps to excrete a lot of the toxic substances, either through the kidneys or through the gut. So I would say, yes, so water is a medicine and it is extremely important or vital commodity of daily living.
Absolutely, and everyone should take it very, very seriously. That staying hydrated is a very, very important part of maintaining your overall health. Because, like doctor mentioned, that our body is entirely dependent on water. It's a wonder liquid for us. It keeps us running. Any system will not work without water. So definitely, that is very important. Doctor, can you please tell us now what are the implications of not having water properly or staying dehydrated?
Yeah, so first of all, just I'll mention the symptoms. A lot of people may not be aware that if they're not drinking enough water, then they may actually be having these symptoms and they will not know that it is due to dehydration. So, say, for example, headache. I see in my clinical practice a very, very common problem. And these are usually young ladies who come with headache. And they may have had all sorts of consultations and lots of investigations, including CT scan and MRI I've seen. And what it turns out when I ask them that how much water do you drink? And the answer by and large is that very little or nothing. So no water. Some of them, they confuse. They say, oh, I take a lot of fluids. And I say, how much water? They say, not much water, but a lot of tea and coffee and juices, which unfortunately they do not add up and they do not help. And tea, coffee, as you will very well know, that they are like diuretic. So they dehydrate you more rather than hydrating you.
Right.
So the other symptoms, apart from headache, I see that the patients or the people may be a bit dizzy. They may have foggy brain. They will not be able to concentrate well. Sometimes if the patient's elderly, they may also be confused. Once they have not had enough water, so there's a condition called postural hypotension. Again, more seen in people who are elderly, and where the blood pressure will drop if they stand up. And this will lead to tachycardia or heart going fast, which will be perceived as palpitation. And beyond that, they will not feel well. They will be fatigued, and they may have leg cramps. The skin will look dry. They will look dull, actually. Water is important for hydrating your skin as well. So that glow probably will not be there. So yes, it is actually helpful, and it also helps to lubricate your joints. So you'll not have muscle aches and pains and the bony pains. So those will be there if you do not drink enough water.
Doctor, I would like to say guilty as charged. There have been so many times where I also have an headache, and I would go around and my parents would tell me that, have you had enough water? And I would be like, no. Like, that is the reason why you're having a headache. And this is such a common thing amongst literally everyone. Everyone would have had a headache because they've not had enough water. So definitely, I completely agree with your insights. Doctor, can you please tell us how important is the pH of water? Like, do you think it matters?
Well, pH of water, the WHO recommends any water which is which has a pH between 7.5 to 8.5, is a good water to drink.
Right.
And it helps very well in digestion and whatever the benefits of water we talked about.
Right.
Now, a lot of people, they go on to believe, I would say, drinking water which has got higher pH, they even go up to 9.5 and 10. And I would actually blame myself that a colleague of mine said, Dr. Syed, get this water. This is very good water in the market. And try to drink this water. And I looked at the pH. It was like, I remember, 9.5 or 10. So, and he gave me lots of reasons to drink alkaline water with a higher pH. And then I was drinking, but hardly made any difference. If any difference was probably psychological. Then I researched a little bit on it, and it came to light that taking water of higher pH, yes, it helps with your acidity if you suffer from acidity, or we call gastroesophageal reflux disease, GERD in short. Yes. But by and large, there is no scientific evidence that that water with higher pH has got any added benefit, or it is safe than the water that is recommended, 7.5 to 8.5 pH.
Doctor, because even if I see in these days, there is a lot of companies, or there are a lot of people who are selling very fancy sort of water bottles, and there's a lot of water, different kinds of water now these days. So yeah, definitely I feel that at large, the kind of water that we have at our homes is pretty much enough for us to carry out our daily activities, and at the end of the day, we just need to stay hydrated.
Whatever pH, if you feel that the water is safe, it is clean, and certainly they measure this ppm, and if they have the minerals tested, and then yes, that's it. You do not need to worry about what the pH of water. Yeah, it has to be within that WHO recommended zone, 7.5 to 8.5 pH.
So, doctor, there is one question that even I have heard a lot many times, and there have not been many people who are addressing this. Doctor, is there anything as too much water?
Yeah, there is a thing. I mean, this is again, if somebody drinks too much water, and when you say too much means too much water in little time, or the other way of saying it, if you drink many liters or gallons of water.
Right.
So these are the conditions actually has been seen in people who are not psychologically sane. So it's a psychiatric condition where the person will drink lots and lots of water. There's another medical condition which is called the diabetes insipidus, where the patient will drink water, but for a reason because he or she cannot concentrate that water, and he loses or passes water to the kidneys. So these are two conditions. Person may actually drink lots and lots of water. So obviously, if you drink a lot of water in a short time, a lot of water, even over a long time, so this is not again healthy.
Right. This is also very wonderful saying that anything which exceeds its limit is not good. Definitely. And even water, like as you very rightfully mentioned, that if you consume a lot of water in a very short duration of time, it can be a difficult thing to deal with. Definitely.
So not too little, not too much.
So, doctor, what is the usually recommended amount of water intake?
Well, again, Dr. Ghazal, that is a wonderful question. And sometimes I quiz my patients. So tell me how much water you should be drinking. And believe me, like 80-90% will have no clue how much water they should be drinking. One, they are obviously not calculating, but it is important to have some kind of idea how much you are drinking, the water, I mean. And it, again, does not include the other fluids like tea, coffee. They actually dehydrate, and even the fruit juices and the other stuff. So it's just the water, drinking water. So normally it is recommended that the intake should be from 2.5 liters to 3.5 liters over a period of 24 hours.
Okay.
Now, if I go a little bit into more scientific recommendation, and it is said that 250 ml per hour as you wake up every hour for first 10 hours, which again approximately is 2.5 liters. So that's the minimum. That's the minimum.
Right.
And if you are in a hot country like where I am at the moment, and possibly in India as well, and if it is hot and humid, then, or if you sweat a lot for any medical condition or physiological condition, Or if you are a sports person, you go to gym and you sweat out, then you
Right.
should add on top of that another 1 liter minimum. So
Yes.
you may drink more, but minimum 1 liter. So
Right.
3.5 plus 1, which may go up to 4.5 liters per day per 24 hours.
And like we've already spoken about how water is the source of so many good things that happen in our body. We are made up of so much water, so it's definitely very important to stay adequately hydrated. And one point I would like to mention, me being a dentist as well, there is something that we deal with which is known as xerostomia, which is lack of hydration in the mouth. The oral cavity becomes very dry. So even in conditions like these, it's so much more important that the individual is consuming a proper amount of water as well. So I just wanted to highlight that, put it out there, that water, it can be a medicine for so many things. So definitely.
Yeah, so different systems of the body. So every
Absolutely.
system of the body requires water in some way or the other.
Absolutely.
And that's
Absolutely.
exactly why our body is composed of water, 60% of the
Yes.
water.
Yes.
And again,
Yes.
I say this is a free gift that is given by God, and
Absolutely.
we must have water at every opportunity.
Absolutely. So I would like to suggest to all our viewers who are watching this today, it is very important for you to stay hydrated. As we keep on saying everywhere, people keep on asking us to stay hydrated, but seriously, even physicians, everyone across the world recommends having a lot of water, the recommended amount, of course. It will help you lead a better life. And like doctor mentioned, that you will even get a glow on your face as well.
Yeah,
So
correct. Yeah.
that is one also very important factor. So yeah,
Yes.
that is definitely right. So thank you so much, Dr. Syed, for being here and enlightening us with so many important things that probably the audience will not be aware of. It is so very important, we as physicians, as doctors across the globe, to educate as well, to create an impact on a larger scale. And we really love what you're doing here. So thank you so much for your wonderful insights.
Thank you, Dr. Ghazal. I think I enjoyed the equally as you did.
Definitely.
And I believe we had a wonderful
Wonderful
discussion.
session. Right. Definitely. Definitely.
Thank
Thank
you.
you so
Thank you
much.
so much.
Thank you so
Thank you
much.
so much. Thank you.